And joining me now is Tamika Walker Kelly, president of the North Carolina Association of Educators. Tamika, I imagine this week has been busy for you, so thanks for taking the time.
Thank you for having me.
So even with preventive measures in place like temperature checks that we just saw, how hesitant have teachers been to return to school this week?
Well, David, we know that COVID is a deadly virus and it has cost the lives of educators here in our state. And we also know that even if people do recover from COVID, they have long-term lasting effects. And so our educators are very worried about catching the virus. And so we need to make sure that we are prioritizing their safety when they return to more in-person instruction and students as well.
And so last week, the governor announced teachers and school staff would qualify for the vaccine beginning February 24th. Do you have any concerns with the rollout?
So we are grateful that the governor reprioritized educators and is committed to a more safer in-person instruction. We do have concerns about the rollout, and so we want to make sure that the governor and DHHS provides guidance to local health departments and other vaccine providers to make sure that educators are, one, able to make appointments to get vaccinated, and two, make sure that places are able to provide vaccines directly to educators.
And also last week, right here in this program, Dr. Mandy Cohen said vaccinating teachers is not a prerequisite for getting back into the classroom. The CDC, with their guidelines, echo that statement. Do you agree with that?
We also know that the CDC guidelines say that educators should be prioritized for vaccinations, especially if they're going to be returning to in-person instruction. And so that is what we have been pushing for in the governor's office and with other entities. We know that 25 other states did prioritize educators, and we're glad that North Carolina is now beginning to do the same thing, because we know our educators want to be back in person with students to continue in-person learning.
And how much will having access to the vaccine put staff and teachers at ease as they re-enter the classroom?
You know, the vaccines are an important piece of a layered approach to mitigation strategies and safety protocols. So it's really important to have that key. We have educators who have already been in person since August. And so we're talking about people who have been working in conditions that have been less safe, and the vaccine provides them with another layer of safety. And for our people returning to more in-person instruction this month and later on in the year, it will provide them with a sense of stability and safety as well.
And Tamika, I'm sure you know there's a bill making its way through the legislature which would require school systems to offer in-person instruction. That's going through our state legislature at the moment. What are your thoughts on that bill?
We know that Senate Bill 37 is extremely problematic. One, because it takes away local control from school boards. It doesn't consider the resources or systems necessary to make sure that we have transparent enforcement of our safety strategies and mitigation strategies. And it leaves out the voices of educators, parents, and communities and decision makers on the local level to make sure that they have data-driven district level plans. And so it is extremely problematic, and we do not support this at all.
Well, Tamika, thank you for your time. We appreciate your insight.
Thank you so much for having me.